Hi, I'm Dr. Dhruv Kazi. I'm an assistant professor of medicine at the University of California, San Francisco, and in the Division of Cardiology at the Zuckerberg San Francisco General Hospital. Despite decades of medical advances, cardiovascular disease, particularly ischemic heart disease and stroke, remain leading causes of death in the US, and that lowering LDL cholesterol, particularly with drugs such as statins, can dramatically reduce this risk in the long term. But some high-risk patients, such as those with heterozygous familial hypercholesterolemia or pre-existing coronary heart disease or stroke, cannot get their LDL cholesterol levels low enough based on statin therapy alone. So last summer, the FDA approved two new cholesterol-lowering drugs, collectively known as PCSK9 inhibitors, because they inhibit PCSK9, a specific enzyme in the cholesterol pathway. These drugs very effectively lower LDL cholesterol, up to 50% reductions in some cases. What we expect is that this LDL cholesterol reduction results in fewer heart attacks and strokes downstream, but this innovation comes at a price. That's $14,000 per patient per year. So it's a substantially more expensive drug for these high-risk patients. The high price of the drug and its potential to impact a very large section of the US population creates this tension. Is this price tag of $14,000 per year a reasonable investment for the health system to make? Our team used the cardiovascular disease policy model, a simulation model that has been extensively peer-reviewed and validated, and tracks all US adults aged 35 years and older over their lifetime. With this model, we were able to examine the effect both on heart attacks and strokes as well as costs of the introduction of PCSK9 inhibitor therapy among patients for whom it is currently indicated. Our model estimated that 9 million US adults aged 35 and over would be eligible for PCSK9 inhibitor therapy. And the benefits could be tremendous. Up to 4.5 million heart attacks and strokes could be avoided over the course of the lifetime of these patients. And yet the $14,000 price tag per patient per year made these drugs fairly unaffordable. They would be considered not cost-effective from the US health system, and in order for it to become cost-effective, the price would have to come down by nearly 70% to about $4,000 per patient per year. What we found is that if all 9 million patients who are eligible for PCSK9 inhibitor therapy were to actually receive the drug, it would increase US healthcare expenses substantially. It would increase prescription drug spending by 38%, so nearly 40% based on this one drug category alone. And if you looked at all US healthcare expenses, it would go up by about 4%. As we know, PCSK9 inhibitors are relatively new drugs, and there are trials ongoing that look at long-term safety and effectiveness that would be really important for understanding the effect of these drugs on the US population. Our concern is that PCSK9 inhibitor therapy is relevant to a very large section of the US population and is meant to be taken as preventive therapy for life. So the drug expenses we're talking about now are on a completely different scale. Our hope is that our findings will prompt a national debate about how we price drugs in the United States.